Although milk blebs or milk blisters are nothing more than a tiny, tiny little white spot on your nipple, it can be really uncomfortable and may even get in the way of your ability to breastfeed. It's also more common than you think. So let's make sure that you know how to recognize them, what you can do to prevent them, and if you do get one, some effective remedies. So there's two types of milk blebs or milk blisters, and the first is caused by a hardening of the skin over the milk duct, which means that there will be a blockage behind that piece of skin. Now you'll find that if you have one of those, the pain is literally localized to that area and can be very painful during feeding. And it takes a few days, sometimes even weeks, to resolve until that piece of skin comes away and then allows the milk to flow freely. The second cause of milk blebs happens within the milk duct itself when some of the milk hardens or there's a fatty buildup. So there's like a long, stringy piece of milk that is blocking that milk duct. The most common causes of milk blisters tend to be an oversupply or if there's continuous pressure on a certain area of the breast. And be mindful of this, especially if you find that you hold your breast in a certain way while you're feeding. Make sure that you move your fingers around so you're not always applying pressure in the same spot, because very often that will be where there is a blockage. The recommended treatment is usually 4 steps: to apply moist heat prior to nursing, to clear the skin from the milk duct if it is a piece of skin covering the milk duct, to clear the blockage itself with frequent nursing or pumping with a hospital grade pump, and then any medication to aid the healing. The medication that is really good and recommended would be an Epsom salt soak or Silver Mama nipple cups because of their anti-inflammatory, antibacterial, antifungal, and antimicrobial action. If you're using an Epsom salt soak before breastfeeding, then use a solution of 2 teaspoons to 1 cup of water, making sure that the Epsom salt is first dissolved in a small amount of very hot water and then adding cool water after that, and applying that moist heat to the breast. You can use a small cotton wool ball soaked in olive oil and applied to the nipple area to soften the skin, and that may cause that blocked area of skin to come away. As with all breastfeeding challenges, I encourage you to get help early from a lactation consultant so we can treat the underlying cause and make sure that the plug duct does not end up becoming mastitis because of the milk stasis. If you would like an additional layer of support, please join our WhatsApp group where you'll get answers to all your breastfeeding questions and the chance to meet other breastfeeding moms.